Good evening, ladies and gentlemen, and welcome to the 24th Scholarship Gala, hosted by the New York chapter of the National Association of Health Services Executives, otherwise referred to as New York Regional NAHSE. I'm Denise Richardson. I co-host the Pledge Drive on PBS, and I'm so pleased to join your celebration this evening, paying tribute to those among us who are making a difference in the lives of New Yorkers. Our honorees, well, they've set an example of what leadership looks like in our communities and have distinguished themselves as leaders in healthcare. New York, an epicenter of the pandemic, continues to experience the impact of COVID-19 on the many lives of friends and families lost, along with its ripple effect on our communities. Let's reflect on those lives and the lives of frontline workers, in addition to Dr. Sandra Gould, a past national and New York regional chapter president whom we lost this year. And now, let's recognize our sponsors for this evening's gala. Greater New York Hospital Association, Hospital for Special Surgery, SUNY Downstate Medical Center, Northwell Health, New York Presbyterian Hospital, Dr. Alex Rovette, Chairman of the Board of Trustees for One Brooklyn Health System. In addition, all of our Friends-level sponsors listed in the program. Joining us now is Minister Laura Middleton Pierce, who's bringing us the invocation, followed by Fabian Stone, who's bringing us a message from National.
Good evening. Father, we thank you for safely gathering us here for this National Association of Healthcare Services Executives, New York Chapter, Regional Chapter 2021 Scholarship Gala. We thank you, Father, for all of these healthcare professionals and their desire to serve others in these trying times. We lift up tonight's event and we saturate it in your love and precious blood. We thank you for each honoree and recipient and your plans and purposes for their lives. We thank you that this event will go forth according to your plan. We thank you for what you are doing through each one of these honoree and recipients. We also thank you for the success of this organization's event. We thank you for the tenure and commitment of its leaders and their endeavors. We give you all honor. In your precious name we pray. Amen.
Hello, I'm Fabian Stone, the president of the National Association of Healthcare Executives. It is an honor to participate in this most deserving event of recognition. Since its beginning in 1968, NAHSE has been committed to supporting and building a pipeline of Black healthcare leaders. Today's event reflects the commitment of your chapter's effort in supporting promising, deserving students and recognizing a group of committed, accomplished executives who are contributing to the healthcare profession. Moreover, the recognition of these deserving honorees significantly expand NAHSE's scope of making a difference within the healthcare community. Thank you to the New York chapter leadership team and members for your outstanding work. And congratulations to the 2021 Scholarship and Award recipients. There is no doubt each honoree uniquely and unselfishly has and will continue to advance NAHSE's mission for eradicating healthcare disparities and eliminating social injustice that disproportionately impact the wellness of Blacks and other traditionally underrepresented groups. Again, congratulations and keep up the good work. Thank you.
Joining us now is Dr. Carl Marie Memnon, NAHSE's New York Regional Chapter President. Dr. Memnon is also Assistant Vice President of Academic Training at Hospital for Special Surgery. She's bringing us greetings and will present the first award of the evening.
Good evening, distinguished guests, friends, and members of NAHSE New York Regional Chapter. Welcome to the National Association of Health Service Executives, NAHSE New York Regional Chapter 24th Scholarship Gala. On behalf of the Executive Board and committee chairs, I thank you for joining us for our virtual event to celebrate our honorees and scholarship recipients. The honorees we are celebrating this evening are truly amazing and inspiring leaders, each leveraging their work to address healthcare disparities, social injustice, and inequities. The healthcare students we're awarding are equally amazing as they are the future. I am grateful to our sponsors, friends, and members for supporting New York Regional. This evening would not be made possible without the contributions of everyone on the Gala committee and supporters who have provided guidance during the Gala planning process. I am thankful to my friends, family, who have always supported me, especially over the past 2 years. As a chapter, we have learned to pivot and prioritize at a rapid pace. The focus has been ensuring NAHSE is not the best kept secret by partnering with universities and colleges and various healthcare institutions. We have held programs over the past term on professional development and Six Sigma, cyber vulnerability, the impact of data analytics on population health, healthcare technology, maternal health, mental health, women in science and research, COVID conversations, census awareness, and leaders in the C-suite. Our expert panelists have come from institutions in the New York region and beyond. We held our annual Young Professional Development Program and hosted a virtual new member orientation. Additionally, New York Regional Chapter led a vaccination campaign where member spotlights were shared during National Minority Health Month to increase members and friends obtaining the vaccine. Community service activities have included the annual Backpack Jam, sisterly conversations with the National Coalition of 100 Black Women, mentoring programs with Greater New York Hospital Association Summer Enrichment Program, Fordham University C-STEP Program, and Bottom Line. While most of our events were conducted virtually, we did have opportunities to connect in person with organizations such as Black Health Connect and Healthcare Leaders of New York. Our chapter marketing has flourished using social media and quarterly president's newsletters. As many of you know, New York Regional Chapter was founded in 1968 and is considered the granddaddy of all chapters. It has been an honor to follow in the footsteps of prior New York Regional Chapter presidents, including Everett Fox, first NAHSE president. New York Regional Chapter remains strong and our future is bright. And we continue to pursue opportunities for our members and support the Black community. The commitment of our committee chairs and committee members have made all of these successes possible. I am thankful to the National NAHSE Office and other NAHSE chapters. My experiences with NAHSE have been priceless and a wonderful learning opportunity. For those who are not currently members, I invite you to join us to continue fostering the spirit throughout New York. Once again, I would like to thank our Gala sponsors. Additionally, thank our institutional members and chapter members for their support. Please, let's give them a round of applause. Thank you all. Now, it is my honor as NAHSE New York Regional Chapter President to present the 2021 President's Award to Dr. Kenya Beard. Dr. Beard is the Associate Provost for Social Mission and Academic Excellence at Chamberlain University, the largest nursing school in the United States. She is a fellow of the New York Academy of Medicine, American Academy of Nursing, and Academy of Nurse Education. I first had the pleasure of meeting Dr. Beard about 6 years ago, where I was fortunate to moderate a panel on diversity and inclusion, of which she served as an expert panelist. Over the past few years, I've had the pleasure of following her career and seeing the impact she has had on advancing diversity, equity, and inclusion, not only in nursing, but the overall healthcare industry. Kenya is a passionate, dynamic, and inspiring leader. She's an educator, social justice champion, and advocates for patient care and workforce diversity. NAHSE New York Regional has been fortunate to have her present at past chapter meetings on population health, health equity, and health disparities, and diversity and inclusion in the workforce. Kenya has written blogs and co-produced healthcare disparity segments for Health Etc. on WBAI FM for an audience of over 400,000 diverse listeners. She has consulted with numerous schools across the country on ways to strengthen workforce diversity. She led the New York State Action Coalition in constructing the state's 2014 Workforce Diversity Toolkit and contributed to the National League for Nursing's 2016 vision statement. Most recently, she co-authored the publication Racism and the Diversity Policy Paradox: Implication for Nurse Leaders to Help Combat Racism in Higher Education. She leads a workshop titled Leading in a Diverse Conscious Society that is supported by Harvard Macy's Institute's Program for Educators in Health Professions. Kenya's work has been instrumental in improving access to healthcare for minorities and is very much aligned with NAHSE's mission. She has received numerous awards and has been recognized for her stellar accomplishments. You can read about them all in her bio. Ladies and gentlemen, this year's 2021 President Award recipient and role model for us all is Dr. Kenya Beard. Please join me in giving her a round of applause. Thank you all.
What an honor and privilege it is to receive the 2021 New York Regional Chapter of the National Association of Health Services Executives President's Award. Diversity is so critical to health equity, that right to achieve one's highest level of health. But every day, that right is denied to far too many. So how can we strengthen racial and ethnic diversity in healthcare? Well, it will be impossible to reach the ideals of diversity and advance health equity unless our institutions, healthcare providers, and leaders are diverse, and collectively, they co-create policies and practices that generate an ethos of inclusivity, belonging, and humanism. We're not there yet. However, NAHSE has been working, mentoring, recognizing, and championing novel ways to create a more diverse healthcare system. You are emboldening the next generation of healthcare leaders with an attitude that reifies the belief that I can elevate the quality of healthcare services inside and beyond the communities I serve. But we must move beyond the talk and facilitate a discourse that illuminates and amplifies our outcomes. We must raise critical conversations and questions that reveal potential disruptors of diversity and ask each other, who have you recognized as a future leader and what door have you opened for them? Have you introduced them to key people? Have you recognized and highlighted their talents even when you thought that it might reduce yours? Can you lead from behind? Can you handle being where someone else wants to be and be the vehicle on which that individual arrives? We are not on this island alone, and without unity, support, and humility, we will be our own demise. As we move up, it is critical that we pour out into others and not just back into ourselves. Share your greatness and believe that no one can take what God has given to you. And never forget the impact that George Floyd's death has had on healthcare, efforts to dismantle racism, strengthen diversity, and our own personal trajectory. We can and will empower the next generation of leaders because we know what's at stake. Our communities, our families, our friends. We have the network and humility to make diversity happen. Thank you again for this award. Thank you.
Thank you, Dr. Beard. Up next, presenting the Trailblazer Award to Dr. Torian Esterling is the Maya Neville Williams.
Good evening, everyone. My name is Maya Williams, and it is my honor as the National Association of Health Services Executives, New York City Regional Chapter Parliamentarian, to present this year's 2021 Trailblazer Award to a healthcare leader for his key role in the transformation of the New York City Department of Health and Mental Hygiene, diversity and inclusion initiatives as it pertains to the city's overall health. This talented healthcare leader serves as the first Deputy Commissioner and Chief Equity Officer for New York City Department of Health and Mental Hygiene. He is being recognized for his work in the public healthcare sector and for strongly advocating on behalf of underserved populations to improve access to quality health services throughout New York City. When I hear the word trailblazer, I immediately think of someone who is blazing a trail to guide others, a leader who is willing to think outside the box, take risks, someone who focuses on results. The recipient of this year's Trailblazer Award has demonstrated significant impact in the healthcare industry, specifically the healthcare of all New Yorkers. Dr. Easterling has spent more than 6 years in a senior leadership role at the Health Department. Prior to serving as First Deputy Commissioner and Chief Equity Officer, Dr. Easterling served as Deputy Commissioner of the Center for Health Equity and Community Wellness at the New York City Department of Health and Mental Hygiene, where he oversaw programmatic work focused on reducing overall premature mortality and closing the racial gap on the top leading causes of preventable death. He also served as the Assistant Commissioner of the Department of Health's Bureau of Brooklyn Neighborhood Health, where he helped advance key programming to address pressing concerns, including maternal deaths and gun violence. Dr. Easterling is a community physician committed to health equity, social justice, and movement building to achieve the health outcomes that all people deserve, both locally and globally. It is truly an honor to present this year's 2021 Trailblazer Award to an exceptional healthcare leader, a role model, community advocate, colleague, and also a friend, Dr. Torian Easterling.
I want to extend my appreciation to the National Association of Health Services Executives, the president, to Ms. McMinnon, to the entire leadership, on behalf of the board of directors of the National Association of Health Services Executive for this Trailblazer Award. I'm Dr. Torian Easterling, First Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. And we've certainly been through a challenging year and a half, and I certainly would not have been able to do the work that I do without countless healthcare workers, public health workforce throughout this city who stepped up and really did tremendous work. And it's important to be acknowledged for the work that I do. But this is important work in order to reach the health outcomes that we want to see in New York City and across the globe. And so I am truly grateful to be acknowledged, certainly by this esteemed body, but also to be joined by this esteemed panelists, many of whom I've worked with across New York City and specifically in Brooklyn. And to that, again, I say thank you on behalf of all the folks that I work with at the New York City Department of Health, over 6,000 city workers who are committed to creating a healthier city, but certainly a city where everyone has the optimal choice to live the best health that they can. Thank you.
And now, presenting the Community Impact Award to Reverend Barbara Felker is Hope Mason.
Good evening, ladies and gentlemen. My name is Hope Mason. I am one of the past presidents of the New York Regional Chapter of the National Association of Health Services Executives, and I am honored to present the Community Impact Award for 2021 to my dear friend and dedicated healthcare leader, the Reverend Barbara Felker. This evening, Barbara is being recognized for her work as co-lead of the faith-based COVID-19 testing and vaccine initiative in collaboration with the governor and the New York State Department of Health. This was an opportunity to provide the Black and Brown communities that were disproportionately affected by COVID-19 access to both testing and vaccines in their communities. Another partner was Northwell Health, where Barbara is also the Vice President of Strategic Community Partnerships. Through her work, she helped establish 24 temporary testing and vaccine sites at churches in designated communities. As co-lead for this initiative, Reverend Barbara Felker leveraged her previous work experiences in the New York State Senate and her long-standing relationships with many in the faith-based community in downstate New York, where she is also an ordained minister. This initiative was critically important because it made access to testing and vaccine sites more readily available to the residents living in low-income communities and minority communities where infection rates, hospitalizations, and deaths due to the coronavirus were higher than in other communities within the state of New York overall. Barbara put her heart and soul in establishing these testing and vaccine sites. Her efforts to also educate communities about the benefits of getting tested and vaccinated were made possible through her long-standing relationships with church leaders and the spiritual community, who spoke to their members, parishioners, and to local residents, also educating them about the benefits of getting tested and vaccinated. They trusted and knew of her integrity as a healthcare executive, and they gave Barbara their support in this endeavor. Mainly because over the years, she has worked with them at their churches and with them with their community events. This partnership between the governor, New York State Department of Health, Northwell Health, and the faith-based community was critical in getting more people tested and vaccinated in order to prevent and/or reduce the spread of COVID-19. We know that there's much more work to be done, and I again want to reiterate that the Reverend Barbara Felker has been on the forefront of this effort and expanding this initiative for testing and vaccines in low-income communities of color and at churches throughout New York City, Westchester County, and Long Island. This evening, the New York Regional Chapter of NAHSE honors her for her tireless work, and on behalf of the members of the New York Regional Chapter and the entire NAHSE family, I present to you this year's Community Impact Award.
Thank you, Hope, for that amazing introduction. I must say your leadership, mentorship, and friendship has been extraordinary to me over the years, and that you truly exemplify the mission of the National Association of Health Services Executives of the New York region. And I also want to thank our President, Carl Marie, and the Board of Trustees for this amazing award for community impact. I truly appreciate it. The community has been a passion, and as a pastor and working with our pastors in the community and the churches, because the pastors and the churches are the trusted entity of the community. So I thank you for this. It's a very special award to me. I also want to thank Northwell Health and our president and CEO, Michael Dowling, for their support and collaboration with NAHSE over the years. We have worked together to try to develop and employ many of the leaders that come from NAHSE. I also want to thank my team members in community and population health for their tireless efforts of ensuring the communities that were disproportionately affected by the pandemic received access, testing, and vaccines throughout the entire 2 years that we've been working on this collaboration with the governor's office and the New York State Department of Health. So again, I thank you. This is an award that is very dear to my heart. We love our community. And NAHSE plays a special role in ensuring that we develop leaders that look like the communities we serve. I've had the opportunity to work with many of the other awardees tonight. I would like to also congratulate you, and I look forward to our continued journey to ensure that not only do we provide access to care, but we develop leaders that look like the community that we serve. Have a great evening, and thank you so much.
Reverend Felker, congratulations. And now presenting the inaugural Healthcare Digital Leadership Award from the chapter to Gil Addo is Ralph Thomas.
Hi, good evening. My name is Ralph Thomas, chapter member of the NAHSE New York Regional Chapter. I am excited to be presenting the Healthcare Digital Leadership Award this evening. This award will be recognizing a well-accomplished healthcare leader who has made considerable contributions to the healthcare technology field and the community and transforming healthcare. Drum roll, please. This evening, this award will be presented to Mr. Gil Addo. Congratulations, Gil. Gil is the CEO and co-founder of Rubicon MD, a digital health platform that allows primary care clinicians to access same-day opinions or e-consults from top medical specialists to improve patient care. It was founded in 2013 and serves as primary care for clinicians across 37 states. The company has raised over $40 million in funding from top-tier venture capitalist firms. In 2015, Huffington Post named Rubicon MD one of the 5 companies defining the future of healthcare. Gil, thank you for your outstanding achievements and contributions leveraging technology in health equity, social justice, and elevating healthcare for minority communities today. Congratulations again, Gil, from NAHSE New York Regional Chapter.
Thank you, Ralph, for those kind words and for this honor. I'd like to thank the New York chapter of the National Association of Health Service Executives for the kind and humbling honor here today. Thank you for all the work that you do to promote and support Black executives like myself, to enhance our health system, and to effectively nurture the next generation of Black leaders. Thanks, of course, to my family who supported me along this journey the last 8 years. You can't imagine what it's like to live alongside an entrepreneur, so I'm eternally grateful for their support. And I'd like to take a moment to recognize the Rubicon MD team. 8 years ago, my co-founder Carlos and I set off on a bold mission to democratize access to medical expertise with this little known interaction called the e-consult. What we do, for those who don't know, is we connect primary care clinicians to specialists for virtual expertise. And over the last 8 years, we've had all types of people who've picked up and left other opportunities to come follow us and to work tirelessly against this mission and to support the vulnerable populations across the country and communities that we serve. We still have so much work to do amidst this very challenged healthcare system and in these very challenging times. But I'm grateful for the sacrifice they've made to join us in this journey, as well as to our partners, our investors, and other supporters in the ecosystem. This takes a village. So thank you all again for this honor, and congrats to the other honorees.
Mr. Edo, congratulations. And now presenting the Senior Healthcare Award to Stacy Williams is Steve Phillips.
Good evening, ladies and gentlemen. My name is Steve Phillips, and it is my honor as the co-chair of the program committee and 2021 to 2023 president-elect to present this year's 2021 Senior Healthcare Award to a healthcare leader who has made considerable contributions in the field and community transforming healthcare. She is the Vice President of Human Resources at New York Presbyterian Hospital, Columbia University Medical Center, with over 29 years of experience in human resources. In her current role, she is responsible for guiding the overall HR strategy for the Columbia campus, as well as the development and implementation of labor strategies for the system. In addition, she holds several certifications, and she currently serves as a management trustee on multiple pension and benefit funds. Ladies and gentlemen, please join me in congratulating this year's 2021 Senior Healthcare Award winner for her outstanding achievements and contributions in building community relations, advancing social justice, and creating inclusive environments, as well as being a role model, Miss Stacy Williams.
Good evening. My name is Stacy Williams, and I am so honored to receive this prestigious leadership award from the National Association of Health Services Executives, the New York region. This last year and a half has been a tremendous challenge for the world at large, specifically to those of us in healthcare, handling, dealing, and coping with the COVID pandemic. And this award truly comes as an unexpected yet welcome surprise for me. It is also a reminder of why we do what we do every day and the value added from our service to healthcare overall and to our communities. I'm humbled and overwhelmed with gratitude for this recognition and would like to thank my team for their steadfast commitment and support of myself and New York Presbyterian Hospital for giving me the platform and space to do what I enjoy every day. And a special thank you to all of you involved in choosing me as the recipient of this honorable award. Lastly, I would be remiss if I didn't thank Pamela Sutton Wallace, who is by far one of the best leaders I've ever had the pleasure to work with. She embodies all of the core values we expect to see in a great leader. She effortlessly inspires those that are seeking a higher purpose, and she creates an inclusive and supportive environment, allowing her teams to be their best. Thank you for being such an incredible colleague and role model who truly emulates the very essence of leadership. Have a wonderful evening.
Ms. Williams, congratulations. And now presenting the Percy Allen Leadership Award to Dr. Wayne J. Riley is Edison Bond Jr. Mr. Bond is also a NAHSE chapter past president and director of patient relations at Bay State Health.
It is my esteemed privilege and honor to present the Percy Allen Healthcare Award to Dr. Wayne Riley, president of the SUNY Downstate Health Sciences University located in Brooklyn, New York. This award is in the honor and named after Percy Allen II, who is a legend in the healthcare industry. This is a special moment for myself because I've had the privilege to work with Mr. Allen as part of his team when he was the first African-American executive director and CEO of the SUNY Downstate University Hospital of Brooklyn. Mr. Allen is known for his passion for addressing the disparities that exist within minority communities. He is known throughout the nation, I even want to say international, as a healthcare leader with a vision to give back to the community as well as providing opportunities for the next generation of healthcare leaders and executives. The reason why I'm involved in NAHSE today is because of Mr. Percy Allen II. It was a privilege to be able to work for him and with him. As a matter of fact, just to be totally transparent, coming to SUNY Downstate was my first career opportunity out of college. And it made a tremendous difference being able to see an executive leader, the CEO and executive director that looked like me. And he has inspired and continues to inspire and motivate me to be able to reach my full potential in the healthcare industry. And so tonight, we shine that spotlight on the great work that Dr. Wayne Riley is doing there in the borough of Brooklyn, serving SUNY Downstate. And so we want to take this opportunity to bring Dr. Wayne Riley to the podium for him to accept the 2021 Percy Allen Healthcare Award.
Hello, this is Dr. Wayne Riley. What an incredible honor to receive the Percy Allen II Leadership Award by the wonderful colleagues at the New York Regional Chapter of NAHSE. I have long known about the wonderful work of NAHSE over the years that I've been in healthcare. The leaders and folks who make healthcare facilities run, as many of you do as NAHSE chapter members, have made an incredible difference over the last 18 months during the pandemic. I salute you and I accept this wonderful award in recognition of the wonderful leadership that Percy Allen II himself provided to our wonderful healthcare administrator community, to the whole field of healthcare administration, and to advancing the important work of NAHSE, and that is to support, develop, and recruit the next generations of African-American healthcare executives. So again, I could not be more honored by this wonderful award by the New York Regional Chapter. And I just urge everyone to continue to be safe, continue to do the great work that you're doing at your institutions and healthcare facilities. And always remember that it is such a wonderful gift to work in healthcare. At the end of the day, no matter what you do in healthcare as an administrator or even a clinician, at the core of it is taking care of people. And that's why NAHSE is such a wonderful organization, because it's people who care deeply about taking care of people. So again, thank you for this wonderful award and best wishes.
Ladies and gentlemen, it's with great pleasure that I introduce you to the recipients of the New York Region's 2021 scholarships. The awardees are each receiving $1,500 towards their educational pursuits. These scholarships are given to undergraduate and graduate students working towards a healthcare-related degree, and they exemplify academic excellence, outstanding leadership, and a commitment to advancements in healthcare. As we wrap up this wonderful evening, please welcome Ms. Zaylene J. Fergus, incoming president, and Human Resources Manager at Columbia University's Vagelos College of Physicians and Surgeons.
Good evening. My name is Jay Fergus, and as president-elect, I am excited and honored in becoming the next New York Regional NAHSE president for 2021 to 2023. Tonight, we thank everyone for attending this wonderful event in recognition of the achievements of our honorees and to award our scholars. If you enjoyed this event, I encourage you, please check our website and check our email for continuing to keep in touch with us. We look forward to continuing this mission and vision, and we want you to be part of it. Thank you and have a good evening.
All the best to you, Ms. Fergus. Ladies and gentlemen, we hope that you enjoyed the evening, and on behalf of our sponsors and NAHSE, thank you for being with us. Good night and good health. I'm Denise Richardson.